Dr. Jeff Mayo graduated from Oregon State University College of Veterinary Medicine in 1994 with honors. As well, he had a second doctorate in veterinary medicine from Washington State University. Prior to veterinary school, Dr. Mayo was a respiratory therapist at Duke University Medical Center, and he received his training in the field from Boise State University. Graduating with a degree in 1986. He practiced many different facets of respiratory therapy until 1990, at which he entered veterinary school full-time. Dr. Mayo holds 5 college degrees from 3 major universities. Please enjoy Dr. Mayo's prepared presentation.
Hello, everyone. My name is Dr. Jeff Mayo. I have a small animal mobile surgical practice based in Seattle, but this week I'm seeing patients in Southern California. Today we're going to talk about radiosurgery use. Sonoquence has evolved smooth wave technology to include bipolar turbo for the coagulation of larger bleeding vessels and bipolar dissection. Sonoquence's smooth wave tissue matching technology ensures a smooth and consistent cut through various tissue types by adapting their RF mode according to the tissue's water content. Unique bipolar turbo mode actually uses a lower power continuous wave to achieve an appropriate effect on hemostasis. It is only at frequencies above 200 kilohertz that the energy passes through the nervous system and is no longer stimulated. The more common radiofrequency and electrosurgical units available in the US operate in the 300 to 2.8 megahertz range, resulting in higher temperatures and collateral trauma at the surgery site. The 4.0 megahertz range is the ideal frequency of operation for radiosurgery, generating the least amount of collateral trauma to the patient. So let's distinguish the difference between the words electrocautery and electrosurgery. So electrosurgery converts DC power to 4 megahertz, which in turn enters the tissue as kinetic energy and ultimately thermal energy without the phoretic effect. That's the shaking that you see of the muscles. This thermal energy is absorbed by the water in the cells, and it causes them to vibrate to the point they reach their boiling temperature, and this causes the cell to explode. 4 megahertz frequency causes the least amount of collateral trauma. Electrocautery units, on the other hand, are battery operated, and they operate at a frequency of 60 hertz or less. They generate heat by passing current through a wire with a high impedance, and this heat is transferred to the tissue. These devices are often used simply to cauterize bleeders after they've been cut with a scalpel blade. This shows an electrocautery device on the left, and on the right what happens when you press the power button. The temperature generated by these devices is in the 60 to 90 degrees Celsius range, which results in desiccation and coagulation of tissue and actually turns blood from liquid to a gel. These are the more common tips available for use in veterinary surgery. Although only approved for single use, I average 10 to 15 uses for these individual tips. It's important to remember that a larger tip requires a higher power setting to accomplish an effect. The first one we'll talk about is a needle electrode, which operates well on low power settings. It's especially useful for making incisions that require a change of direction, something called sectility, such as around the base of a tumor or performing an entropion. It's best used on the cut mode. The loop electrode is used on a blend mode. It's the tip of choice for the planing of tissues, removing small tumors and forming resections of the alar fold in the nose. This loop can be changed to different sizes. The ball electrode is used for coagulation or hemostasis. It can also be used to shrink small tumors or assist in ablation of a small tumor. The blade electrode requires a higher power setting, on average of about 25 to 30 when cutting canine skin. It does not change direction as well as the needle electrode does. When you turn the blade on its side, it becomes useful for spot coagulation of bleeders. Lateral heat can be a clinical problem with any electrosurgical device when it is not used properly. I'd like to go into more extensive detail on the basic 4 factors that produce excessive lateral heat during surgery and what you can do to control them. Lateral heat with carbon dioxide laser use was probably the most common complication in terms of tissue damage. Since lasers cut much more slowly without tactile sensation, they require lateral pressure to enhance their cutting effect. It's easy to create a heat sinking effect with this effect, and this can profoundly increase lateral heat to cause more trauma and delayed healing. If you have too high of a setting, you'll see sparking at the electrode tissue interface. If the setting is too low, you will get some drag of the electrode through the tissue and it might burn the edges. The ideal power setting results in the tissue cutting with ease, no pressure, no sparking, and the ability to move through the tissue at a constant speed. If you have the same machine in different settings, i.e. more or less power draw during a given day, that can cause the machine to react differently. One power setting may work well for one patient, and the next patient may require adjustments at the start of the procedure. Power variables include the patient's size, water content, or hydration, whether you're cutting fat versus muscle, and if there are other devices running on the same circuit in your clinic. Your electrode size choice will depend on what you want to cut and how precise you want to cut it. As a rule of thumb, again, larger electrodes will require higher power settings. Larger electrodes also can cause more scar tissue and more lateral heat. So there's no one correct setting because changes in power consumption will occur, the tissue that you're trying to cut, resistance of the target tissue, size and age of the patient, how clean or used the tip is, the age of the handpiece, and how much it's been used. We tend to recommend starting at 15 to 20 with cats. This is using a blade electrode, and 25 to 30 with dogs. And these numbers are for the SonicWinds unit specifically. Remember, these numbers are relative settings to the total power that's available in the machine. So as I said, radiofrequency works by simply bringing the water in the cell to a low temperature boiling point where it converts the cell to vapor. If you'll remember, a cell consists of 70% water. The steam also assists in coagulation of tissue and blood vessels. Smooth wave is unique to the SonicWinds unit in that the impedance of the tissue being cut is being matched by a smooth, continuous wave from the unit to minimize distortion and dragging through the tissues. Thus, in the ideal situation, what should the maximum temperature be in the tissue? The answer to that is the boiling temperature of the water. As the temperatures increase to 50 to 60 degrees Celsius, we get cell death. As it approaches 90 degrees, we'll have instant cell death. desiccation of protein, denaturization, and the cells will shrink. When you get up to 100 degrees Celsius, the water in the cell will boil, resulting in a steam envelope around the tissue you're cutting. And this is the vaporization that you see. When temperatures get above 100 to 200 degrees Celsius, the result is something called carbonization and caramelization of tissues with extensive collateral trauma. And this is often seen with lasers since they can reach temperatures higher than that. So let's take a look at the different waves available in the sonic lens machine. We have a fully filtered wave, which is 90% cutting and 10% coagulation. This allows for clean tissue margins to improve healing and histopathology quality. This is ideal for your initial skin incision and provides optimal aesthetic results. It produces the least amount of cell destruction and creates a clean edge that is easy to suture and quick to heal. The coag wave is a 50-50 blend wave that's ideal for dissection and planing of tissue and is used in highly vascular areas. It's ideal for doing subcutaneous tissue dissection and planing. It's also great for minimal lateral heat and tissue damage, and it will increase coagulation but still allow for clean cutting and a good aesthetic result. The 90% partially rectified wave is ideal for monopolar coagulation and ablation of tissue. It's used for subcutaneous tissue dissection and has maximum hemostatic control. There's controlled penetration of minimal absorption, and we don't get that much tarring or necrotic tissue. We can do indirect coagulation by touching another instrument that could be attached to a bleeding vessel or piece of tissue. So what is hemostasis in radiosurgery? So we get this thing called white protein coagulation when we're approaching 100 degrees Celsius. We get rupture and reformation of hydrothermal bonds. We get cellular dehydration and desiccation. This is what's exploited to seal a blood vessel. Historically, we were using mutated waves that led to some superficial carbonization, yet caused some shielding and delayed healing and poor hemostasis. The current theory is to use a cutting mode with a lower power to create a more homogeneous seal. Indirect coaptation is recommended, and as I said on the previous slide, this simply means holding the vessel with a forceps and touch the tip to the instrument to create the seal in the blood vessel. This is good for up to about 2 millimeters. Bipolar coagulation means that the radio wave only travels between two poles of a forceps. The neutral plate is not required. Silver tips on the ends of instruments minimize tissue adherence and will increase performance. Some people say this should define all radiosurgery units as the energy travels between the tip on the handpiece and the distribution pad, which satisfies the definition of bipolar. We also get some pinpoint accuracy when we're using smaller instruments. We don't really see any appreciable charring or tissue necrosis. This is the ideal way for dissecting in and around critical anatomy. I like to use this when I'm taking like parathyroid gland tumors off of the thyroid gland or working very close to an eye. So this is the foot pedal that comes with the sonic lens unit. So whichever mode is lit up on the unit will be activated when you press the cut blend pedal. The bipolar works off of a modulated rectified waveform. Bipolar turbo works off of a continuous waveform. Both work off of a 1.7 megahertz frequency. significantly higher than traditional bipolar technologies, and we get less burning and sticking of the tissue. So with the bipolar turbo, we're talking about boosted power for enhanced coagulation of larger or stubborn bleeding vessels. This dedicated foot pedal has pretty easy access and activation. And again, you'll want to attach some silver smooth bipolar forceps, produce very little to no tissue adherence to the forceps. You also have a very small pair, which is nice for dissecting around things like adrenal glands, small tumors, and again, the parathyroid gland tumors that we see. This silver tipping and the bipolar turbo limits the charring and tissue necrosis. We like to call this the de-stress pedal when you get a large bleeder and you can't get it stopped. So we'll grab it with bipolar forcep and step on the bipolar turbo button. So what is the neutral plate and where should we place it? So neutral plate technology, we really should be calling these things dispersion plates now. Dispersion plates or rubber pads are intended to prevent the patient from being electrocuted. So the current must be isolated by the machine and returned to it or it will not function. But these newer units and these rubber pads, you don't need contact gels or wet towels between the patient and the pad. It's not recommended anymore. In the older units, sometimes they would ground to other things that would result in electrical burns. I've seen some electrical burns on patients in various cases. Current bus, but again, must be isolated by the machine. These rubber pads are nice now because we don't have issues with their breaking. They're much more robust and just don't seem to cause issues anymore. In this example, we see how a 1 millimeter squared tip is dispersed over the dispersion pad, which prevents electrical burns. Coated grounding plates are metal ones, which when they get damaged have been known to cause severe patient burns. So for example, if you have 1 watt of energy coming out of a 1 millimeter tip and you disperse it over a 10 by 10, now you've got 100 centimeter squared or 10,000 millimeters squared, and all that energy gets dispersed out of that. That energy really can't cause a problem anymore. So this is the updated neutral plate or dispersion pad. It's a rubber pad now and it has a much longer cable to it. The connections are more robust, scratch proof. The wires can't be bent into connections as we would see with some of the older plate designs. This plate is just not likely to ever burn a patient. So what about fat? Older machines just could not cut through fat. Sonoquin's tissue matching technology can do that. There are other tissues that you can or cannot be cut, and you should keep that in mind. The things that we don't cut with radiosurgery. That would be the eyeball, a tooth, and a bone. Never cut those 3. So we have this phenomenon called antenna coupling, and this is when radio frequency interferes with other devices like pacemakers, IVs, Dopplers, and EKGs. What's happening is we have some stray radio frequency energy and these devices are not shielded. If the cords are too close to each other and you're using high power, one cord will pick up the other. So if you separate these cords and avoid parallel placement, you should decrease this incident occurring in your operatory. Try separate plugs. There are these things out there called RF chokes or radio frequency chokes. They really only filter power coming through the power cord and not the handpiece power cord itself. So this is a new instrument we just got started doing some clinical testing on. This is called the SonoSeal. So this instrument is in production for release hopefully later this year. The intent of this instrument is to be able to coagulate and seal blood vessels as well as soft pellets. We have found many, many uses for this instrument, and I'll present more video in a later course. The design of this instrument pretty much mimics the neonatal Satinsky clamp, and we just turned it into a bipolar instrument. This was our very first test on the clamp on a piece of bacon, at which time seemed to be close to what a soft palate might be like. We had the instrument set on about 30 and it separated the bacon in just a few seconds.
They wanted to know where exactly to place the neutral plate in the presentation.
So the neutral plate should be thought of more as almost like an antenna, and it in some of the newer units it doesn't really matter where it's at, but we like to recommend it be close to the surgery site so you get the best transmission of energy from your tip to your dispersion pad and avoid burns. Don't put water on it; it doesn't need contact gel. And if you have a metal dispersion pad, you don't want that to be on a metal table as well, because then the entire table will be grounding the dog.
Is there a benefit for radiosurgery versus CO2 laser surgery?
I think that soft palate resection is successful with either of those. The laser turned out to be a fairly okay device for doing soft palate resection. My concern with the laser is the potential problems with, of course, a fire, setting the tube on fire, having oxygen back there, having scattered energy go around throughout the back of the pharynx area. You can end up causing some burns. Looking at the operational cost of the laser, you've got, if you're using a waveguide, that costs money. The tips cost money. If you're using an articulated type laser, then you still got the cost associated with maintaining that. And for me, at least, it was a little bit hard to get an articulated laser down into the throat to get that done.
Yep. Next question. What is the optimum operating frequency for a radiosurgical unit?
4 megahertz seems to be the best. There are some that are lower, and I've seen 1 or 2 that are higher, but there seems to be no advantage to going higher than 4 megahertz. As we go lower than 4 megahertz, the resistance to the energy passing through the tissue will increase, and we tend to get more collateral trauma from that.
Please explain Sonoquent's I-200 and I-100, the difference on how Sonoquent's accessories are helping the veterinarian industry and how veterinarian industry is changing as a whole with radiofrequency.
Wow, that's a big question.
Sorry
So there's I-100. Yeah, and I'm not a salesperson at all, but the I-100 doesn't have bipolar on it. The I-200 does. The I-100, excuse me, is a lower power overall, and it's more intended for doing very small things. So if you're working on exotics, if you're only going to do like small cats and very small dogs, the I-100 might be for you. If you want to run bipolar instruments like the new one we showed, we've also got several other instruments out there. You need that power for the I-200 to be able to put enough energy into that device to get the effect that you want on it. Overall, I think what Sonoquents and radio frequency is doing for the profession out there is we've got an instrument now that does precision cutting. It's very good at controlling blood flow. We decrease our post-op morbidity. We don't have the issues with post-op bleeding that we do when we cut with a scalpel. We're able to cut better. We're able to cut more precise. And ultimately, we end up providing better care, better surgical procedures, and our patients go home at the end of the day in a lot better condition than they might had we done the procedure with a scalpel.
Wonderful, wonderful. Question. It seems like it's going to be a rating question. They'd like to know which of the following attachments would require the highest power setting and the least. The 3 categories are scissors, highest or lowest, needle, electrodes. Yep, needle electrode.
All right, so needle electrodes can operate on the lowest amount of power. As an instrument gets exponentially bigger, it takes more energy to get the energy out there and create the effect. So when you go from a needle electrode to, let's say, a blade electrode, you're going to need a higher power. I might go from 12 to 15 up to maybe 25 to 30. When we go from that blade tip up to the scissors, now we're talking maybe 45 or even high as 50 or 55, depending on what we're trying to cut with it. And we're more likely to use the turbo button when we're using such a big device, just to get that extra power out there if we need it.
Mhm. Wonderful. Next question. They need to know, can you autoclave the tips with steam?
I don't autoclave them with steam. I did some research a couple of years ago on plasma energy, and we actually did some work with another company on a plasma energy sterilizer. So we do put those in plasma energy, and they will last quite a while. I get quite a few cuts out of there. I don't recommend autoclaving them. They're not for that. And the same for the hand pieces. They're not meant to be autoclaved. They're supposed to be one use thing, but veterinarians don't do that. We like to use things 20 times before we get rid of it. Sonoquence is working on a handpiece that is going to be autoclavable. I don't know the release date on that. I might have more information on that by tomorrow.
Wonderful, wonderful. Next question. Viewer would like to know, current radiosurgery units, can they accurately cut fat? So can the current radiosurgery units accurately cut fat?
I know for sure the Sonoquence unit can cut fat because I've done it. I've taken out some of those dermoid cysts in the ridgebacks. They have a lot of fat in them. We've cut a lot of large lipomas off of dogs using the scissors with the Sonoquence unit. I know units that I had previous to that just were not good at cutting fat at all. So yes, the Sonoquence unit can definitely do that.
Wonderful, wonderful. The next question, which tissues cannot or should not be cut with radiosurgery?
Bone, teeth, and eyeballs. That's it. And I always say eyeballs because I'm not an eyeball surgeon. I think on the human side, they are doing some either periocular procedures or doing something pretty close to that. But I don't have any information on that because I fancy myself an orthopedist, and I know that's close to ophthalmology, but it's not close enough to me.